Hi everyone, my name is Mario Torres and I'm an administrative fellow here with Gila River Healthcare. And on today's segment, we're going to take a look at our Podiatry Department, which is included in our newest expansion at Huhuka Memorial Hospital. So we're going to get to follow along with one of our patients as he makes his way through his podiatry appointment. And then also we're going to interview some staff as well. So come on, let's go meet the patient. Good morning, good morning. My name is Mario Torres and I'm an administrative fellow here with Gila River Healthcare. Now, I understand you're coming today for your podiatry appointment, is that correct?
Yes, sir.
Okay, is it okay if we follow you along on your journey this morning?
Yeah, that would be great.
Okay, great. And then really quickly, I'm gonna have you introduce yourself to the camera and tell them your name, please.
My name is David Lewis from District 5.
Great. Now, David, thank you. We'll come to your podiatry appointment.
Hello, do you have an appointment? All right, the patient screening area is right over here.
All right, so we're going to talk a little bit to Danielle with customer service. Danielle, good morning. How are you doing?
Good morning. How are you?
Good, good. So we're filming a segment, In the Know, keeping our patients in the know. And one of the things I wanted to ask if maybe you can share how customer service, or what are some of the things customer service is doing for keeping our patients safe?
Hello, my name is Danielle. I'm with customer service. I'm a customer service representative. So with customer service, what we do is we wear double mask, we wear our goggles, we always have gloves handy. We wear these visible vests so we can always be identifiable to the patients and staff. And we also disinfect patient areas and wheelchairs, patient wheelchairs after every use.
Oh, Danielle, thank you for all you do. I appreciate it. Have a good day.
Thank you.
Okay, and you'll take your paper with you to the podiatry window. Thank you.
All
Have a good day.
So Vanessa, we're following David along this morning on his podiatry visit. Also, I was wanting to know if you could share, kind of talk a little bit about the screening process, so that way when our patients come back for their podiatry visit, you know, they kind of have an idea what to expect.
So you'll find a screener at every entrance. What we're doing is taking safety precautions for every patient. We'll be checking temperatures, asking any COVID questions. Have they been exposed to anyone, any symptoms? If they say no, they're clear. As long as their temperature is under 100, they're able to proceed with their appointment.
Okay, great. And so kind of this whole thing's big safety precaution, right?
Safety precaution, and everyone is given a green wristband if they're clear to go. So everybody's identified by this green bracelet as being cleared to be on the premises.
Great. Thank you, Vanessa.
You're welcome.
Have a good day.
You too. Thank
Bye.
you.
Kind of wait over in our waiting area. They'll be with you shortly, okay? Thank you. Have a good day.
Alicia, good morning. How are we doing?
Hi, good morning. I'm good. How are you?
I'm good. So we're following along David for his podiatry appointment.
Okay.
And I was wanting to know if you can share a little bit about the plexiglass and kind of what we're doing with our patient registration team.
Okay, perfect. So the plexiglass is going to be here to protect ourselves, also on our patients. Along with our plexiglass, we're going to be provided with our scrubs every day, along with the N95 and a surgical mask, as well as our protective glasses, just to ensure that our patients are safe as well as us as well.
Great. No, it's awesome. Alicia, thank you very much.
You're
Have a
very
good
welcome.
one. Okay?
Have a good day.
Okay,
Thank
bye.
you.
So David, I'm going to let you go to your appointment, and we're going to break off here. I'm going to go interview some of our other staff, okay? All right. Have a good one.
Thank you.
Thanks. All right. Hi, everyone. So we're here today with one of our podiatry providers, and I wanted him to introduce himself, and we were going to ask some questions about our new expansion.
Hi, I'm Wes Taxier, one of the staff podiatrists here. I've been with the Gila River Healthcare Corporation since 1995. And we are really excited about the grand opening of our new podiatry clinic. Our previous clinic was 7,500 square feet. Our new clinic is 15,000 square feet. So we increased from 12 treatment rooms to 20 treatment rooms. And this includes 2 rooms that we have for our nurses to do wound care and dressing changes on wounded patients. Yeah, so one of the coolest things about our new clinic is that We have X-ray on premises, so we can take foot, ankle, and leg films right here in the department. And patients won't have to go down to X-ray or radiology department anymore. So that'll be a lot more convenient for our patients, and it'll be more efficient for our staff. So, you know, with the onset of the pandemic, one of the hardest things that we had to deal with was we had to cut down to a skeleton crew in podiatry. And we really were only able to see the most urgent cases with the smaller staff. But now, with the expansion of the new clinic, we are able to get those patients back in and treat them in a safe and comfortable environment.
Maybe can you talk a little bit about why it's important to come back, and maybe when they do come back, what can they expect?
So, you know, it's hard sometimes with diabetics to decide, you know, what's urgent and what's not urgent, because really most things when you're dealing with a diabetic foot, which is the majority of our population, a lot of things really can become urgent very quickly. So, you know, people were not coming in for routine things like nail and callus care. And in diabetics, those nails and calluses can build up, and because the diabetics often don't have good feeling, they can't tell that there's a problem with their foot. So we want to get those people back in and take care of all these routine problems before they become big problems, which in our case, a big problem are foot ulcers and infections. So we want to get everybody back into the clinic, back on their routine, get their routine diabetic foot care taken care of, and take care of all those aches and pains and deformities that people have been staying home and suffering with.
Yes, no, thank you. And for any patients that may be a little bit hesitant about returning to, you know, on-site visits, what would you say to build their confidence?
Well, we are going to be still following strict COVID protocols at the hospital. So you'll see that our staff are wearing masks, N95 masks, and we'll be wearing eye protection. In between the patient visits, our rooms are going to be thoroughly cleaned and disinfected. And also, as a provider, we are tested every 2 weeks for COVID to make sure that we are safe and we are not going to expose the patients to any germs. You know, we'll be able to welcome everybody back. We encourage patients to give us a phone call, set up an appointment, and come in and be seen in our new clinic in a safe and clean environment.
Great, no, thank you. So kind of what I'm hearing is that as patients come back, they can be very confident that their safety is going to be top priority.
Absolutely. Okay. We are going to follow our strict guidelines. We're going to have ample seating in the waiting area for the patients to be spaced apart. And we're going to make every effort to follow our guidelines to keep our patients safe from exposure.
Great. Dr. Taxier, thank you for your time. I appreciate it, sir. Have a good one.
You're welcome. Thank you, Mary.
Hey, David. I hope your visit went well. So, you know, you came in, you went through your visit, you got to see the entrance and our screening process. So I was wondering if you can tell, what do you think about the space, the new space?
I think it's excellent. It's a one-stop shop. I was even able to get my X-ray here during my visit.
Gotcha. Great. All right, let's go this way. All right, everyone. So now we're going to talk to Kiki, who's one of our MAs here at Podiatry, and we're going to ask her a few questions. So, Kiki, good morning. I'm Mario, and I was wondering if you can explain kind of what are some of the safety precautions that we're doing between our patient visits.
Okay, so between our patient visits, we always want to make sure we clean, sanitize after each patient. We'll put the paper down, set the chair up, set the mail stand up for the next patient. That's how we set up the room for the next patient.
Great, Kiki. No, thank you. I appreciate it.
Yeah, no problem.
All right, have a good one. All right, bye. All right, everyone. Well, this concludes this segment on In the Know. I did want to give a special thank you to David, our patient, for allowing us to follow along on his podiatry visit. And I just want to say, I hope that you feel more safe and more confident now, and kind of get an idea what to expect when you come for your next podiatry appointment. So please give our podiatry team a call and schedule your appointment today. Thank you.